We're talking about, getting these notifications with the update of the CDC community transmission maps last night. Now it's seeing a whole bunch of red or orange for the Central Virginia region here. As someone who's been dealing with this epidemic since the get-go here, what was your reaction when you saw, this move to high?
Well, I'm not entirely surprised. We're certainly anticipated that there would be another wave, particularly as there are new variants. And I think this is an potent reminder to all of us that COVID-19 has not gone away. It's also a reminder to many of us that if you're not vaccinated, now is the time to get vaccinated. If you're vaccinated and not boosted and eligible for a booster, it's time to go for a booster. And also, it's also a time to reconsider using masks, particularly in situations which pose higher risk, like being indoors in poorly ventilated areas.
That was the thing. If you could go over just again, I know this seemingly that the big thing is here, and the difference between precautions on a low, medium, or high is that any sort of public indoor space, use a mask, or if you're a high risk individual, maybe even consider avoiding non-essential public indoor stuff. Can you just sort of walk through, now that we're in high,
Yes.
what do you tell people?
Yeah, so with higher risk scenarios like we're seeing now for crowded indoor spaces, particularly ones that are not well ventilated, to use a mask, and that's highly recommended to minimize transmission between individuals. And then for individuals who are higher risk, either advanced age or chronic underlying conditions, it's strongly encouraged, or they should strongly consider not attending events that are crowded and indoor, just to keep themselves safe. Of course, if they do attend these events, they certainly wear a mask. An approved mask, such as a KN95 mask or a surgical mask, would probably be better than a cloth mask.
And I guess, the big question here is, once these tornado watches are going, being Memorial Day weekend, I'm assuming a lot of people will be doing stuff outdoors. Can you say what the best recommendations are with, potentially large gatherings outdoors? Is it, mask if you can't social distance, or because transmission is lower outdoors, people can stay maskless?
So outdoors is always safer than indoors. It's not entirely risk-free, but it is significantly less risk than being indoor. Certainly outdoor in a crowded environment, if someone is at risk for high risk for potential complications of COVID-19, and they should certainly consider wearing a mask even if outdoors. Still, when outdoors and if feasible, try to distance as much as possible from others. But definitely choose an outdoor scenario over an indoor scenario if feasible. And if you're at high risk for complications from COVID, consider wearing a mask even outdoors.
I don't know if you're going to know this off the top of your head, but I know, the metrics that go into these CDC ranking is hospital capacity and percentage of hospital capacity currently being used for COVID patients, for COVID beds. Do you have a rough estimation of what you're seeing at VCU Health in terms of those numbers?
Well, I'd like to be careful. I don't have the exact numbers today on the hospital capacity, but I would say that as cases rise in the community, there's a concern about increasing hospitalization with COVID. We're certainly nowhere near as being overwhelmed or overrun by COVID-19 in the hospital this time, but certainly it's also something we don't want to take lightly, want to be well prepared and keep ourselves finger on the pulse of that.
And that's the other thing, looking at the graphs related to COVID, and you see the different heights of the wave here. I know I asked someone at RHHD of, what's the prediction with this wave? Is this the start of a new big one? Is this just going to be a small little blip? And obviously the hope is to contain this. Do you have are you able at this point to give a prediction in terms of what we're seeing the start of?
Sure. My prediction is probably not going to be severe as the previous wave of Omicron for various reasons. One of which is we have greater collective or kind of community immunity to it, such that there should be less transmission and there should be fewer hospitalizations. So probably not as severe, but still not insignificant. So again, individuals who are at high risk should be vaccinated, if already vaccinated, get boosted if eligible, and if indoors, wear a mask. If outdoor and high risk, consider wear a mask still.
Anything more you'd like to add, Dr. Behrman, or feel we haven't touched on?
No, I think that as you know, COVID is not going away. It's important for us to be mindful of the ongoing transmission in the communities, be mindful of the availability of vaccines and boosters, and be mindful of the use of masks, particularly for those individuals highest risk.